About 2 weeks ago, the Parliament approved a budget framework of 69.4 trillion shillings for the year 2026-2027, which is actually less than the current budget. I immediately thought about our health spending. Last year, the health budget had doubled to 8.1% of the national budget, which is a very good thing, except that it is still below the recommended 15% by the Abuja Declaration. Now, you might be wondering what the Abuja Declaration is. In 2021, African countries agreed to dedicate 15% of their national budgets towards health. The idea was simple. The more money towards health, the better the hospitals, the better care that we get, and more medicines in the hospitals as well. Uganda has never reached the 15%, and that explains why healthcare still has challenges today. Even when health budgets increase, the reality on ground still feels tight. Uganda spends roughly $30 to $40 per person per year on health, and this has to stretch across hospitals, medical staff, medicines, vaccines, and long-term illnesses like cancer and diabetes. When you look at the scope of these needs, it becomes clearer why health systems always feel strained. With all that in mind, it shouldn't come as a surprise that there are always frequent drug stockouts and high patient-to-doctor ratio. The demand for healthcare is simply much bigger than what the current funding can cover. That is also why government programs frequently prioritize preventative care like vaccines and maternal health, because preventing an illness is way more cost-effective than treating the illness later. But while national budgets and public programs focus on the bigger pictures, individuals and families still face very real everyday moments. A sudden medical bill, a test that can't wait, or a treatment that needs to start right away. And this is where solutions outside direct government funding start to matter. Cell-care operates in this space, but supports people at the point where affordability and timing become barriers. It is less about policy debates and more about practical access, bridging the gap between needing care and receiving it right away.